Hi there. In the next few minutes, I want to present what healthcare looks like in the Netherlands. I'll use a few complaints or medical conditions and take you through a journey from getting to a general practitioner and being referral to specialist care. I want to thank Expat Center for their partnership, and together we strive to make your stay in the Netherlands balanced, healthy, and happy. Before I continue, a little bit about myself. My name is Sabine. I'm a mother of two young, beautiful girls, and more than 30 years ago, I came with my family, my parents, and my siblings to the Netherlands, and we came here as expats. The rest of my family traveled elsewhere, and I stayed to pursue my medical degree and have been a resident in the Netherlands for over 20 years. So I know what it's like to access healthcare from both perspectives. Furthermore, I am an advocate of mental health issues, and I'll detail some of what we do with mental health awareness later on. I'm currently doing a PhD on air pollution and child health, and next year I will be finished and hopefully also will have obtained my GP trainee certificate. But don't worry, I've been a doctor for over 15 years, and the majority of my clinical experience is in emergency medicine. I'm also the clinical director of the platform Expat Health Clinic. As mentioned earlier, this presentation is really about depicting a journey into the healthcare system in the Netherlands based on some common medical presentations, and each will tell a story of what you can expect from a general practitioner or a GP, here also known as a huisarts. And some of the common mistakes I've seen, and I would like to help you avoid having to get frustration when you're going to seek medical attention. All in all, the goal is to provide you with the right tools so that you build a good rapport with your general practitioner to get the best treatment available without unnecessary delays or frustrations. So, I will start with one of the most common things that expats experience, especially those with young children. So, what happens when your child has a fever and you feel like you want him or her to be seen and you're not really getting that message across? I want to reassure you that every child with a fever is always going to be taken seriously. The medical guidelines recommend that infants less than 6 months old should be seen by a doctor. And if a child has fever and is otherwise well, in most cases, it could very well be a virus. So once you contact your general practitioner in the Netherlands, you typically first speak to a assistant. She or he will ask you a series of questions to assess the severity of your child's illness. And in many cases, the advice will be something like give your child some paracetamol, or it will be something like it's most likely a virus. You can make an appointment when things get worse. And I've seen in some certain cases that it leaves parents frustrated and upset, and they feel like they're not being taken seriously. But there is some evidence behind why not every child with a fever needs treatment. In 25% of the cases, a child with fever typically has a viral infection. In almost all viral infection cases, these are self limiting, meaning that the child's immune system will fight it off. And in up to 20% of cases, the cause of these viral infections are from the upper respiratory tract, typically the nose, the ears, or the throat. And in a lot of cases, that's due to congestion. And a child with congestion can develop a fever. If you treat the congestion, the fever will typically go away and the child will feel better. And lastly, in less than 10% of cases, a fever can be of serious nature. So when is it serious? Well, what does that actually mean? Well, this is what the GPs and the assistants would like to figure out how serious is your child's fever. I think it's really important to highlight that your concerns and intuitions play a huge role. As a parent, you know your child best, and if your intuition tells you there's something not right, then let that be known. And as health professionals, we typically ask, well, what do you think it is? And that's just only to gauge the level of anxiety towards a problem, and if you're concerned, this will play a role in the next steps to take. So it is not strange for general practitioners to ask what you think, not specifically to get you to diagnose a condition, but it is more to see if you think your child is able to cope, can you cope, and how worried are you? Another symptom to look out for and to share with your GP is if there's any changes to your child's general appearance. This again reflects your concerns the most. So if your child starts having breathing difficulty or the colors changing, is feeling really unwell, it's not eating, is feeling drowsy, share that. And absolutely, those are reasons to be worried. And of course, if your child is having a convulsion with or without fever, you absolutely need to contact emergency services. So, a tip when your child has a fever, it's really best to measure the temperature, preferably rectally, then state how the breathing is, whether or not the child is feeling drowsy, and also state to the GP or the assistant, well, I'm worried because, or I'm concerned about. And it's also good to at least try some paracetamol according to the recommended dose per weight before you contact your GP. That way, we can better assess the severity of the case. Another complaint that is very known is, particularly in women, is urinary complaints. So many females with these symptoms are used to urine tests being performed. Here in the Netherlands, it is unlikely that a GP will automatically request culture tests because evidence shows that if a woman is otherwise healthy and has good response to certain antibiotics, the most common cause of a bladder infection in women is known to be E. coli. These bacteria are sensitive to certain antibiotics, and it's recommended to prescribe one of them and then assess how symptoms are going. Only in the case of a recurrent urinary tract infection, despite antibiotics, then a culture of the urine will be indicated. There's even an issue of doctors sometimes not prescribing antibiotics immediately, and that is because the majority of cases of a bladder infection or urinary tract infection is mild and resolves by itself. So, for example, drinking enough fluids or cranberry juice can help resolve the symptoms. A referral to a specialist in this case is usually not necessary. So remember that in the Netherlands, general practitioners, they are generalists and specialize in the care of general medical conditions. So we know a little bit about a lot of conditions, and it helps us assess what is urgent and what needs to be treated now and what can be referred later to a specialist. And a specialist is one that knows a lot about one or few conditions. Let us talk a bit about cough. Especially in the time of COVID 19, this was and remains a common symptom that has made many people worried. But if cough, is it always bad? Well, outside the recommendations by the public health authorities, which is to have yourself tested for COVID 19 if you're coughing, and also make sure that you take up the public health advice for distancing. A cough is really a reaction to a complex mechanism that the lung has to protect itself. So, in effect, coughing can be a good thing. A cough does not always mean there is an infection. Other factors play a role, like irritations from smoke or certain household cleaning products, even allergens like pollen or grass pollen, and if you're allergic to, for example, to pets. Other factors such as gastric reflux can also induce a cough, and mucus in the nose from congestion is also another trigger. So, what happens is that the lungs are protecting themselves and that initiates a reflex and you start to cough. But remember that a cough from an upper respiratory tract infection is also most likely viral and self limiting. But if a cough is coming from somewhere lower in the respiratory tract, it could be due to asthma or an infection like pneumonia. And typically, the symptoms will vary because the one from a lower respiratory tract infection will be generally associated with weakness, fever, poor health. If a cough lasts longer than 4 weeks, then typically this requires a workup in the form of x rays or lab tests. But if there are no other worrying symptoms, then it's okay for a cough to last up to 3 to 4 weeks. I know it doesn't sound like people want to have a cough for that long, but usually it's no cause for any permanent harm. So when should you be worried if you have a cough? Again, if you have a fever, reduced appetite, you feel drowsy, short of breath, you're not able to lie flat on your bed, you hear a wheeze, or there's other issues that affect your immune system, for instance, then you have to definitely let a medical professional know. So let's talk about the topic concerning fertility. This is one in which general practitioners are trained to guide couples who want to have a baby through this journey. When a couple realize that they are not succeeding in becoming pregnant, a GP will take a full history of both partners, including how often and how long they've been trying to conceive. Then a full medical history, including operations and any occurrence of sexually transmitted diseases, will be addressed. Also important to note is the effect of moving, going to a new country, getting a new work. These can also affect fertility. Males would typically receive a sperm analysis to assess sperm motility, and women will be asked more about their menstrual cycle. Sometimes a referral to a gynecologist will be made, and other times the GP will refer the couple to a fertility clinic. It's also important to discuss with your insurance company what is covered beforehand. So, when it comes to fertility assessments, and in fact, with many other ailments and conditions, general practitioners in the Netherlands typically make use of guidelines, protocols, and they also use tables like this example, which can assess the chances of conceiving a child according to age and progressive movement of a sperm. In the event that a woman has a normal menstrual cycle, a negative STI test, and the sperm analysis is normal, one can see that a woman aged 20 will have 50% of conceiving if the amount of normal sperm cells is 60%, and typically that 50% chance of conceiving is within a year. The older the female is, the lower the chances are of conceiving. This is just an example and highlights what GPs use to base their recommendations on. Now, I know there are always outliers and exceptions, so I just think that it's important to discuss your expectations with your general practitioner in order, again, to build that good rapport. I acknowledge that building a relationship with a GP can be challenging, especially when you're coming to a new country. Things are very different, and the Netherlands, the healthcare system here is quite different than other countries. But before, as I mentioned, a general practitioner is one that can refer you to specialist care in the Netherlands. Another example is referral for mental health conditions. So, if one suffers from mild symptoms like anxiety and depression or stress, then typically that can be managed within the GP practice. Moderate mental health symptoms like depression, ADHD, and autism are referred to outpatient psychology centers for assessment and treatment. And when it comes to complex cases like schizophrenia or psychosis, these usually go to see a psychiatrist. And this slide is literally to depict how challenging it is for people with mental health problems to get help when they need it. And as of 9 months ago, the average waiting time to get mental health was about 13 weeks, and over 13,000 people with anxiety were on the waiting list. I can tell you right now that this number is rising as we speak. This is another example of how long the waiting list is for conditions like moderate to severe mental health conditions. It's very hard when there's no support or advice. And this is where Expat Health Clinic can also play a role. And I'll talk a little bit more about our services in a few minutes. So, GPs play a huge role in access to healthcare in the Netherlands. They manage over 80% of clinical conditions and can refer to specialists. But as an expat, it can happen that you have a family member come over and visit, and what if they unfortunately turn ill? Or sometimes GPs will tend to the care of your family member, even if they're not registered with a GP. And they will typically be known as a passerby, and they will have to pay upfront fees to be treated. The cost can be sometimes steep, but in all cases, emergency help is always available, regardless of one's registration status. So you may ask me, well, what about getting yearly checkups and blood tests or pap smears or ultrasounds? Can a GP arrange all these things for me here? Well, it depends. Typically, GPs do not regularly recommend yearly blood check or checkups or tests unless there's a risk of developing a condition. So remember the slide that I showed you with the tables? Well, these are some of the examples of guidelines highlighting when annual checkups should be done and which group of patients. So if you do not fall under a certain category, the chances that your GP will initiate a checkup is quite low. But there are again exceptions. And in the Netherlands, there are private clinics where you can go and get these things done at your own cost. And again, you might need to contact your insurance company to see if they will reimburse that. So before I close, I want just a short recap. GPs are generalists and they specialize in a whole bunch of various medical conditions. And they are the first point of care and manage over 80% of conditions here. If you're worried, let your GP know. Ask for a double consultation with your GP if you feel language or culture is a factor or barrier in your relationship with your general practitioner. And it's worth building a good rapport with your GP. It's really vital for a healthy stay here. Here in something many of you can read on social media about expats frequently raise frustrations about the care that they receive from GPs, especially when they hear things like take a paracetamol. So what I like about one of the responses is really what I want to share with you and offer as a tip, where it's, you might need to just change your approach. It's very important to build a healthy relationship. It's really good to explain to your GPs that you're from a different culture and lay out your expectations. Always keep an open mind and remember that the Dutch healthcare system is still one of the best, and their approach is based on science and pretty much a lot of evidence. And if the GP doesn't know what to do, they typically will refer to somebody who knows more. So at Expat Health Clinic, we have partnered with Expat Center to offer you a solution for you when you can't find a general practitioner or you have a family member that is here temporarily. So we provide GP type services. Consultations are typically done online through telehealth. And if you need a medication because you have a pre existing condition and you don't have a general practitioner yet to prescribe, we can offer that service too. We also offer family health package for you and your young children, and that really entails that we want to listen to what your concerns are and make recommendations regarding your child's well-being. And a lot of things that I want people to realize is that when you live in a new country, it's really, yeah, some people think it's easy to adjust, but for some people, it can be quite tough. And especially if you're coming to a new country and you've suffered from previous trauma or past psychological events, having to adjust to a new situation can actually exacerbate mental health issues. In our adjustment program, we offer an extensive psychological, nutritional, and medical assessment. And the goal really is to give you tools and treatments so that you can maintain a balanced mind and body well being while here. And if you want to talk to me or to find out more what we do, you can visit our website. It's an email address. And one of the things I like to do is talk about mental health issues. So this is also a link to my podcast and my mentor. We're doing this with a lot of guest speakers, and hopefully, very soon, we'll have more guests talk about how things like COVID, moving to a new country affects your mental health, and what are the things that we can all do to help each other have that balance and just a very good sense of well being. I thank you, and I thank Expat Center again for their partnership, and I wish you a healthy stay. Thank you.